So next we will move on to the idea of prevention. So what is prevention? Prevention is the idea where you are trying to stop the ills or the consequences of a disease progression. So a disease is progressing, and the disease is progressing to cause some mortality or morbidity potentially, and we will try and prevent that from occurring. We will try and stop that from occurring. So prevention by the stage where it is done is classified as primordial, primary, secondary, or tertiary prevention. Okay. The common form of prevention that we know is commonly referred to as treatment, is known as secondary prevention. So secondary prevention is when a person is already diseased, we are trying to prevent death or disability in that person. And that is secondary prevention. So we are doing treatment, early diagnosis and treatment to prevent the consequences of the disease when the person is already diseased. That is secondary prevention. What is primary prevention then? Primary prevention is when a disease has not yet occurred, but exposure has occurred. And the risk factor is present. The agent or the risk factor is present, but the disease has not yet occurred. So there you do primary prevention. What is tertiary prevention then? Tertiary prevention is the disease has occurred and the disease has resulted in some disability, some impairment. Now that person has to live with that irreversible damage. So you try and ensure that the person is able to lead as much of a socially and economically productive life as the person can lead with the existing disability. Okay, so that is tertiary prevention. And what is primordial prevention? Primordial prevention is the sense where you're trying to address even before the person is at risk. Okay. So what are the interventions per se in under each of these models of prevention? So as I was saying, in secondary prevention, the disease has already started. So what you would like to do here is early diagnosis, and once you diagnose, prompt treatment. So the two cardinal interventions of secondary prevention are early diagnosis and prompt treatment. Now, if the disease has not developed, but the person is at risk of developing disease, then what you do is you do primary prevention, which involves health promotion and specific protection. It involves health promotion and specific protection. Primordial prevention is also similar. It also involves health promotion and specific protection, but it is just different from primary prevention in a way that primary prevention is done once risk factor is already present. Primordial prevention is doing the same thing, health promotion and specific protection, even before the risk factor has arrived. So going even ahead in time and trying to prevent any possible chance of the disease, that is primordial prevention. And tertiary prevention, adjusting the person. So tertiary prevention is when the disease is already occurred, the disease has already advanced. So in that you're trying to reduce the amount of disability that occurs out of the disease. You're trying to prevent any further disability from occurring. And you're trying to ensure that the person with the disability is able to lead as much of a socially and economically productive life as possible, known as rehabilitation. Okay, so if you look at the activities that are to be done under each of the levels of prevention, in both primordial and primary prevention, we will be doing health promotion and specific protection. In secondary prevention, we will be doing early diagnosis and prompt treatment. And in tertiary prevention, we will be doing disability limitation and rehabilitation. Okay. So how to do health promotion? Health promotion is simple. You can do health education, you can do information education communication, you can do social behavior change communication. So it is just telling the people, augmenting their knowledge, trying to ensure they have the right attitudes, they have the correct behaviors, so that they do not have the host factors or they do not become susceptible to the environmental exposures that lead them to be infected with the agent. Okay, so that is health promotion. What is specific protection? Specific protection, as you can see, the example is immunization. So you're administering a vaccine. So you're giving a specific form of prevention which is protecting you against one particular type of disease, like vaccination. In secondary prevention, we have to do early diagnosis. Now, the only way to do early diagnosis if we can diagnose before the usual time of diagnosis. So, usual time of diagnosis is after the appearance of signs and symptoms. So, if you have to diagnose even before the appearance of signs and symptoms, then you have to do something known as screening, where apparently well individuals who are having some risk will be checked for the presence of early pathogenesis of a disease process. That is known as screening. And once you're able to diagnose early by screening, what you have to start is prompt treatment. So we have treatment under national program, we have treatment for TB, we have treatment for many diseases. Am I audible? Am I clearly audible? My internet connection is showing unstable.
Yes, sir, you're audible.
Okay, fantastic. Next, in tertiary prevention, you want to do disability limitation. So a person, they're having some impairment that is leading to some handicap and some disability. So you try to ensure that that person can lead as much of a socially and economically productive life. So you try to limit the disability and you try to provide rehabilitation. Try to provide rehabilitation. Okay. So we'll discuss these things in further detail going ahead. So if you try to put it in perspective, for example, perspective of an infectious disease, we know that an infectious disease, we have already read this, that an infectious agent, post environmental factors, they will interact. It will produce a stimulus in the pre-pathogenesis period. Finally, once exposure occurs, infection occurs. So after that, you have the early pathogenesis, you have the discernible early lesions, advanced disease, and convalescence. So let us observe that what are the things that we can do in various levels of prevention. Yes, Srinjan.
Sir, I didn't understand the difference between primordial and primary prevention, as both were health promotion and
Okay. So for example, Srinjan, you are having a 17-year-old adolescent individual, okay, with a family history of diabetes and obesity. So now, this person, would you consider this person to have some risk factors of diabetes?
yes, sir.
So I'm giving you a scenario of a 18-year-old adolescent, 18 years old adolescent who has family history of T2DM and is obese. So this is a person with risk for diabetes, isn't it?
Yes, sir.
Now you take this person, you take this adolescent and you counsel him, you educate him on proper nutrition, physical activity, and regular sleep. Okay. You educate this 18-year-old adolescent with family history of T2DM and obese who is at risk for diabetes on proper nutrition, physical activity, and regular sleep. What are you doing here, Srinjan?
Primary.
So, what you're doing here essentially is primary prevention. You are doing primary prevention. Okay. Now I give you a 7-year-old child normal height for weight. Normal weight for age. And no family history of diabetes. But still, anyway, you want him to adopt a healthy lifestyle and you educate that child on proper nutrition, physical activity, and regular sleep. What are you doing here?
Sir, this is a primordial.
This is primordial
But
prevention.
sir, if for example there was a 7-year-old child, normal height for weight, normal weight for age, but has a family history of diabetes, so then
That
also
is
it
a
would.
risk factor. That is a risk factor. If this person has a family history of diabetes, then they have a genetic risk factor towards developing diabetes.
Then also it would be a
Okay.
primary prevention.
It should ideally be primary. We many a times end up saying primordial, but it should ideally be primary. The moment a person has a definitive risk factor for the disease already, and then you're going and addressing it, it is primary prevention. If you're able to address something before the risk factor is already there, then it is primordial. Now, many a times how people will analyze it, people will say that if a wrong behavior has already established itself, like the person who is obese is already not having proper nutrition or physical activity, isn't it? And that's a behavior. So there, like educating to convert is more difficult, as in primary prevention. Well, if this child has normal height for weight and normal weight for age, this child has already healthy nutrition and physical activity habits in all likelihood. So if we are able educating this child on these things, the chances of maintaining that nutrition and physical activity into adulthood are much easier and more likely that the child will adhere. So that is the basic difference between primordial and primary prevention. Okay, the primordial prevention, you are trying to start your preventive activities even before things start going wrong. Okay. So as we were saying that primary prevention or primordial prevention will have to be done in the pre-pathogenesis period, where the risk factors have not yet appeared and the disease process has not yet begun. So there we will do health promotion. Now what we mean by health promotion? By health promotion we involve health education, as we have already discussed, a good standard of nutrition adjusted to the development phases of the life, attention to personality development, very very important. Okay, because our behavior will determine all of our non-communicable diseases. So attention to personality development, provision of adequate housing, recreation, agreeable working conditions, marriage counseling, sex education, genetic counseling, and periodic examinations. So all of this, it comes under health promotion. What is specific protection? So specific protection, most common and most easy example to remember, immunization. So vaccination. Other than that, So attention to personal hygiene. You're specifically addressing gastrointestinal and respiratory illnesses. Use of environmental sanitation. Again, you're specifically trying to address gastrointestinal and respiratory illnesses. Protection against occupational hazards. So if you're using a PPE, a personal protective equipment, you're trying to specifically reduce one particular form of occupational hazard. Protection from injuries. You're using a helmet, okay, while playing cricket. So that's a specific protection from injury. You're using a helmet while riding a bike. That's a specific protection. Okay, a specific protection from the disease of accident. Okay, use of specific nutrients. So you're giving supplements, specific nutrition supplements to prevent their deficiency diseases. Again, specific protection. Okay, avoidance of allergens, protection from carcinogens. So all of these are specific protection. Okay, while you're trying to prevent specific diseases through a preventive intervention before the disease process has begun. Okay, so health promotion, specific protection. Next, moving on to secondary prevention. So in secondary prevention, you have early diagnosis and prompt treatment. So in early diagnosis and prompt treatment, what you will do so case finding measures. Now, case finding measures can be individual and mass. So how can you do individual case finding measures? So suppose I am considering non-communicable diseases. So the individual case finding measures is also known as passive screening, which is suppose you are a person who is above 30 years of age and you come to me with any disease. You have come to me maybe with fungal infection, or you have come to me with, say, you have come to me with sore throat, cough and cold. You have come to me with fever. But since you are an individual above 30 and I think that you are at risk of non-communicable disease, what I will do is I will also advise you to get your blood pressure checked, and I will also advise you to get your fasting blood sugar done. So you're an individual who came to me. I did not go to you. You came to me. You came to me, but you came for some other disease. You did not come for non-communicable disease. But I am screening you anyway for the non-communicable disease because you are at risk by virtue of you being above 30 years of age. So I am doing passive individual screening. Okay, why is it passive? It is passive because I am not going to you. You have come to me. But I am using that opportunity of you coming to me to do a screening. So that is a individual case finding measure. Okay. Mass case finding measure. So I will go into the community. The ASHA worker will go into the community. The ANM, the CHO will go to the community. ANM and ASHA will go to the community and they will collect the community-based assessment checklist form, the CBAC form for all people. They will do a fasting blood sugar of all people above the age of 30 years in the community. Or they will go into the village and they will ask everyone whether they have had fever in the last 14 days. This is known as mass screening. And this is active screening, mass active screening. Okay, where you have not come to me, but I have gone to you because of my need to estimate the burden of disease in the community. There will be an active going to the community and doing the screening among them. Okay, so early diagnosis and prompt treatment, it involves case finding measures, individual and mass screening surveys and selective examinations. Okay, the objectives are to cure and prevent the disease process, to prevent the spread of communicable disease, to prevent the complications of sequelae, and to shorten the period of disease, and disability. Okay, so that is what comes under secondary prevention. That is what comes under secondary prevention. These two come under primary prevention. Under primary prevention. Then you have disability limitation. So what is disability limitation? Once the disease has already advanced, it has already progressed to advanced stage, we give adequate treatment to arrest the disease process and to prevent further complications and sequelae. So we are doing disability limitation. Okay, so provision of facilities to limit disability and to prevent death. That is disability limitation. And what is rehabilitation? Rehabilitation is once disability has already occurred. You're trying to adjust that person to their environment, to their society, to their job, to their family, so that they're able to live the optimum socially and economically productive life with their existing disability, despite their existing disability. So, rehabilitation is provision of hospital and community facilities for retraining and education for maximum use of remaining capacities. So there can be various forms of rehabilitation. We will come to it. We'll come to it. So these two, disability limitation and rehabilitation, they constitute tertiary prevention. They constitute tertiary prevention. So you have primary prevention, secondary prevention, tertiary prevention. And this primary prevention, if you're doing this even before the agent or the risk factor is existing, then you're doing primordial prevention. You're doing primordial prevention. Okay. So primary prevention, health promotion, intervention to prevent future occurrence of the disease, as we were discussing. So example is health education in case of non-communicable disease. You have lifestyle modification, behavioral interventions, environmental modification for vector-borne disease. So maybe you're going and you're removing all vector breeding sites. So environmental modification, nutritional interventions like food fortification. All of these, they come under health promotion interventions. Specific protections. So this is to ensure disease would not occur in the future at all. So you're specifically targeting one disease. Immunization against vaccine preventable diseases, contraception against unwanted pregnancy. Okay. Unwanted pregnancy. Next, secondary prevention. So you want to do early diagnosis. So we do screening. As I was saying, screening can be two types. It can be passive screening, where so screening, it can be passive and active. It can be passive and active. So if people are coming to us and we are taking that opportunity to screen for something else, that's passive screening. If the healthcare workers are going into the community and they are taking efforts to get the people who otherwise did not take any initiative on their part, that is known as active screening. Screening can also be into further approaches known as a mass approach or a population based approach, and a high risk approach. So if the disease is one that affects a high portion of the population and the screening test is such that it is cheap and easily administrable, then we will opt for a population-based screening, where we will want to go to the population and we will want to screen everyone to see for whether the disease is present or not. But if the screening test is invasive, or if the disease is such that it occurs only in certain people with some specific risk factors, then we will adopt a high risk approach, where we will first go and check for whether the risk factor is present. If the risk factor is present, we will label that person as high risk, and only the high risk people we will want to subject them to the definitive screening test. Okay, so screening tests, they can be passive and active based on how it is done, and it can be population based and high risk based on how much of the population we are involving in the screening procedure. For example, so we do cervical cancer screening by visual inspection with acetic acid. So cervical cancer screening, as you can see, it involves a procedure. So it is done in a high risk approach. Okay. While self breast examination, breast cancer screening, self breast examination, it can be done by everyone. It's cheap, easily done by self, can be done regularly, does not involve any expenses or invasion. Okay. So self breast examination, all women above the age of 30 years, they should be taught to do it on their own. Okay. Next, prompt treatment. So early treatment will prevent mortality, it will prevent complications, it will prevent the appearances of disabilities. So like we do DOTS, directly observed treatment short course in tuberculosis, multi-drug therapy in leprosy, we give highly active antiretroviral therapy in HIV. So all of these, the idea is to do prompt treatment to ensure that mortality and complications do not occur. You know, with highly active antiretroviral therapy now in HIV, people can live 30, 35, 40 years with HIV without suffering from the severe consequences of HIV. Okay, they can lead almost a close to normal life. So that is all about secondary prevention. So in tertiary prevention, what we are trying to do is we are trying to reduce disability. We are trying to do disability limitation. So when we talk about this, there are three terms: impairment, handicap, and disability. So what is impairment? So if due to the disease, there is any anatomical or functional loss, then that is known as a impairment. So suppose we consider there is a road traffic accident. So road traffic accident is the disease. Road traffic accident is the disease, and the road traffic accident disease leads to an impairment, which is a limb loss. So the anatomical or functional loss in the body is the limb loss that occurs as a result of the road traffic accident, which is the disease. Now this impairment leads to a disability, which is a inability to perform day-to-day activities. Okay, inability to perform day-to-day activities like locomotion. Okay, that is a disability. Okay, and that finally leads to a handicap. Okay, which is an inability to perform an existing social role. Okay, so going ahead, what we do is we do rehabilitation. We will do rehabilitation. So what is rehabilitation? Rehabilitation is training and retraining individuals to ensure that they are able to achieve the highest possible levels of functioning with the existing disability that they have. Okay, so it is training and retraining the individuals who are having some impairment and disability to ensure that they are able to function optimally. They are able to restore as much of function as is possible. Okay, so always remember the difference between impairment, disability, and handicap. Impairment is the anatomical loss, disability is the ability to perform day-to-day activities out of that anatomical loss. Okay, so RTA disease, it leads to limb loss, which is the impairment. The person cannot locomote. So the inability in locomotion is the disability. And by virtue of not being able to locomote, that person might be unable to perform my expected social role, which is a job, and that might lead to a inability to perform the social role, that is unemployment. Unemployment is the handicap. So RTA is the disease, limb loss is the impairment, inability to do locomotion is disability, inability to walk. Okay, inability to walk. Inability to walk is the disability, and unemployment is the handicap. So what you're trying to do, you're trying to address the disability. You're trying to address the disability in such a way that the handicap is reduced. Okay, you're trying to address the disability in such a way that the handicap is reduced. So what is rehabilitation? It is training and retraining the individual to a highest possible level to ensure that the functioning is restored as much as possible. So a prosthesis limb, if it is given here, a prosthesis limb, it can be able to restore the function. Okay, if the person is able to walk, then the disability is reduced and they will be able to do a job. So the unemployment is also, the handicap is also addressed. Okay, so rehabilitation can be of various types. You can have medical rehabilitation that tries to restore the bodily function. For example, physiotherapy after CVA, after amputation, if you give them a prosthesis. So that's medical rehabilitation. You can have vocational rehabilitation, which is restoring the ability to earn livelihood. So suppose a person was doing some work with their hands, Now, if one of the hand, it was a ambidextrous job, something that requires both hands for functioning, and that person by accident loses one arm, then you train them to do such a job which requires only usage of one limb. Okay, and that is so restoring the ability to earn livelihood with the existing resources that that person has. So that is vocational rehabilitation. So you can do some job skill training, some workplace adaptation that allows them to continue working. Okay. Next, you have medical rehabilitation, vocational rehabilitation. Next, you have psychological rehabilitation. Psychological rehabilitation is restoring dignity and self esteem. So, for many diseases that are associated with some huge mental trauma, for example, HIV, a diagnosis of HIV. So, after that, or leprosy, okay, where people face a lot of discrimination and they can have a lot of problems with existence in the society. So you restore their dignity and self-esteem and allow them to exist in the society and lead a socially and economically productive life. Okay, so that is psychological rehabilitation. And you can also have social rehabilitation, restoring family relations. Okay, so marriage or just relationship with parents and all of that, you restore that. Okay, so that is rehabilitation. Okay. So just looking at the example in case of pulmonary tuberculosis. So if you are considering the various levels of prevention, you can be given long questions like this. Okay, that how would you apply the various levels of prevention in the control of pulmonary tuberculosis? Okay, so there you would have to answer in detail. You would have to describe, but you can just refer to the schematic diagram. So maybe for say for So in terms of primary or primordial prevention, you would have to teach people cough etiquette, the importance of proper nutrition, why it is required, and how it can prevent disease. Then specific protection, the BCG vaccine, it prevents kids from having disseminated forms of pulmonary tuberculosis and other complications of tuberculosis, TB meningitis, TB spine, all of that it can prevent. So specific protection by immunization. Okay. Secondary prevention, early diagnosis. So you do sputum examination, syndromic surveillance, you do CB-NAT examination to diagnose TB. Once you have diagnosed, you implement DOTS. You implement the directly observed treatment short course. You start the treatment. Tertiary prevention, so disability limitation, the person already has tuberculosis, is on treatment, advanced disease, and is malnourished. So there you have the Nikshay Poshan Yojana. You have the Nikshay Poshan Yojana. So what it will do is it will provide nutritional supplementation. It will provide nutritional supplementation to the tuberculosis patient to ensure that the malnutrition is addressed and the person is able to come out of tuberculosis by virtue of malnutrition being addressed will give them better immune function, and that immune function will help them cure the disease. Okay, so Nikshay Poshan Yojana can be considered a digital disability limitation strategy as part of tertiary prevention of pulmonary tuberculosis. Okay, and medical rehabilitation, after the person has recovered from tuberculosis, you can refer that person to chest physiotherapy, and that will be medical rehabilitation. Okay, so this is how you have to approach the various levels of prevention for a particular disease. So far, you have any questions with respect to levels of prevention? Do I still have you?
Yes, sir.
Okay, no questions. It is clear, it is understandable. See, these are the fundamental concepts of public health, okay, which you have to be absolutely clear with. You cannot have there is no scope for having any doubt with respect to these things.